So advanced therapies offer transformative potential, especially for patients with few or no other treatment options. They offer hope towards a curative outcome, which could save lives, it could reduce lifelong treatment burdens, and ultimately improve the quality of life for patients and families. But they also come with significant challenges. These treatments are associated with very high upfront costs. For example, the recent gene therapy for haemophilia B that I mentioned earlier has a list price of £2.6 million per patient. And there's also considerable uncertainty around their long-term effectiveness. We're talking about new treatments that have been developed over the past 10-15 years or so. So we don't yet have decades and decades of outcomes data to show how well they work over a long period of time.
And the challenge that we have is not so much the scientific one as you often face when you're developing drugs. It's very much the population that we're trying to treat is far too small to go down the traditional sort of regulatory approval pathway. If we're treating 1, 2, or 3 people, it's not clear what that regulatory pathway looks like. But Julia, who is a true inspiration if you get to meet her, sort of made it her life's course to think about how do you bring children these drugs in the future so that ultimately children and parents don't have to suffer knowing that there's a potential treatment but not being able to access it through the classical and standard channels of medicines as we know them today.
I mean, I think there are a few things that we definitely acknowledge that there are challenges and there are gaps in the regulatory system to facilitate this access of safe and effective treatment to our patients. We are reviewing the regulations and we want to make sure that the regulations follows the science and it is fit for purpose. The other challenge, I guess, is more particularly, like you said, for ultra-rare disease, even N of 1. And I guess it is all about the difficulty in generating that evidence. We're closely working with our partners, so NHS England, NICE, to look into how the regulatory framework can be shaped in the future for these kind of very rare diseases.
As you know, if you look at whole genome sequencing in particular, the vast majority of whole genome sequences available in the world today are in white populations. But we've got to get to a place where it becomes routine that as part of clinical practice, particularly for rare disease patients, that they get access to the sequence and the testing necessary to be able to diagnose them.